So 5 years ago, when people came and asked me, and some of these people may be in the crowd, and asked me, when do you see a cure? I told them, not in the next 5 years. I would not say a sentence like this today. I think that there is clearly a stage, we've reached a stage where this talking about therapy is not just promises in the air, but actually something going on. And we will try and advance it as much as possible. With your help, with your collaboration, with your open and awareness that this disease should be eliminated and treated as much as possible. Thank you very much for having me here. I'm very happy again to be here.
I would actually like to have a short question and answer session as well. But also we wanted to just have Dr. Kakis in the room, if you don't mind standing up so everyone knows who you are. And also Dr. Kavadmi is in the room tonight as well, if you don't mind standing up. And Dr. Razor from North Shore is here as well. Dr. Shapiro as well from North Shore. And Dr. Lalejade is here. Lalezade, yes. There's a few other doctors in the room as well, so I won't mention everyone, but we would now open the room for discussion, question and answers from anyone who would like. Yes?
I'd like to ask your recommendation to the Michelle community. How do you think we should inform our young people that are not married? What procedure do you recommend to prevent the young couple from having children with HIBM?
It's a very important question. I'm not so sure that I'm the right person to ask it. Clearly, the leaders of the community have to get the word around. Tests can be done. We have a genetic counselor here at North Shore. It's a blood test. It's as simple as, you know, you go to, there is nothing unique about it. You have the leaders, the social leaders. There are people in each community, people who are leaders, whether they are rabbis, just social leaders and respected people of the community for other political or social or whatever reasons. Write about it. Do you have an internal journal? Write in that journal. Do you have a network of people? Write, you know, like a summary of the visit that was here and the testing. Put all these points and let people, and leave a telephone number, because I have learned, since I came here, I can tell you, I have a nice room in a hotel here, not a fancy suite or something. I have seen patients in my room, this morning also, at 9:30, in my room on the unmanned bed. They didn't want to stay more than 1 second in the lobby in case somebody knows. Like the, you know, criminals that are selling them drugs. If you talk about it, you will be successful. In that sense, I have to commend the community in LA. They have done this work to a certain degree, very successful. It's not like, there are still people who are hiding there too. I know them because they come to meet me when I'm in LA. But they are not as shy like they've done. This is a matter of the community decision. I don't live here. It is your responsibility, or the respected people that are here and some that are not here but may have, to get the word around, leave a telephone number, leave a place, decide amongst you, have an organization like show, whatever, but also maybe to give a telephone line to people who are not part of the community. You know, like Dr. Shapiro or somebody, that if the people will call, they will know that they don't get their secret. So that's as much as I can. Yeah. Okay. So of course, if you get tested, sometimes there are couples who found out that they are carriers, and because are carriers, they have a 25% chance for each child to have a disease. There are certain possibilities. One of them is a possibility that is practiced among many secular people. You can go ahead and have a baby like the usual way, but test the fetus. And if you can test it like you do amniocentesis, you can test it and see if the fetus is affected or not affected, many that he is homozygous. I want to tell you in brackets that not every homozygous person will develop a severe disease. In fact, nobody can promise it today, but there are 3 people in the world who have passed their mid-50s who are homozygous for the disease and don't show any signs. But you cannot rely on that. So then it's your personal decision what you want to do with this pregnancy, whether you want to continue it, whether you want to abort it. I know that abortion is not an issue of doctor. Abortion is an issue of belief to yourself, and everybody makes his own decision, and that is a decision that in that doctors are no better in making that decision. But if this is not possible because of your beliefs about life, okay, then you can test it before implantation. You can do pre-implantation testing on a single cell. So you produce the fertilization in your test tube, you take one cell out, you test, and you can decide then that this fetus, which is already 8 cells, that is all, right? 8 cells, that is all. You can test it, nothing will happen. This is being done in many diseases. And then the ones which are okay, you put them. It's not guaranteed like in regular pregnancy, but that is also a method that you can use. So there are prevention methods to have it, and you have your own genetic children. By the way, this is all in counseling. I mean, like, these are practices that if you go to genetic counseling, they will tell you about that. This is being practiced not only for HIV, it can be practiced for many other diseases. Yeah, go ahead, I just don't hear you.
You discussed about the remedies and the treatment and the medication that now about to develop. Explain a little bit more.
The development of medication is different from the development of gene therapy. These are 2 different avenues. The medications are all based on the idea that the disease is caused or at least partially affected by lack of sialic acid. So sialic acid is a sugar. You can put it into theoretically in a tablet. Dr. Kakis is smiling because each of these sentences means a lot of work and a lot of till you actually do it, but that's the idea. You take this substance, which is a sugar, you put it in a tablet, you measure how long it stays in the body, how long it spreads, and then hopefully if it works, you can take it as a tablet. Okay, so whether you choose one or the other, that's really I would say, a more technical decision than anything, although it's not like easy techniques. Did it answer your question? Okay. Yes.
Hi, Doctor. Well, first of all, I just want to thank you for discovering the gene. And I also wanted to ask, I know it's early in this new gene therapy that you're looking into, but I was curious, is it something, I know a lot of the other treatments that have been tested that they haven't been able to kind of, reverse effects to people that have been tested for several years. Is it something that you think it would,
You're asking me about timing. That's...
No, I'm asking if you can reverse effects of someone who's already had wasting.
Yes, well, okay. So what happens if you treat somebody who's already having symptoms? So let's be honest about it. If a muscle cell is dead, you cannot revive it. But weak muscles are not only because muscle cells have died, some of the muscle lose their ability to produce power at a normal level, but they are not dead. Those, theoretically, you can revive. Furthermore, in HIBM, when you do a biopsy, not all the cells are degenerating. And that is why people, I have a patient who started his disease at the age of 30, and until his late 60s, I was writing to the municipality of Tel Aviv to give him the permit for special parking of his car. He was driving and he was getting out of his car to his house 30 years later. So the fact that it's slowly progressive means that not all the cells die at the same time. You want to prevent those cells that have not even started to degenerate to go into the process. So the only thing I can tell you is that when we talk about therapy, about gene therapy, it is not aimed at someone who doesn't have any symptoms. It is aimed at people who do have weakness. And we hope that it will either arrest the progression or improve all those cells that can still